Welcome back in the channel of Clinical Care Insight. We started a series of lecture on neuroanatomy and neurophysiology. Until now, we already discussed about the basic introduction of, we can say, the nervous system. Okay, we also seen the classification of nervous system. Okay, then we seen the basic structure and functional unit of nervous system, that's called the neurons. Okay, and we also seen that apart from the neurons there are other cells, okay, which is working in the nervous systems to making them you can say their physiology optimum. Okay, and we term those cells as a those cells as a neuroglial cells. Very good. Then we make the difference that neurons and neuroglial cells are different in so many ways, but the one of ways is that the neurons is the excitable cells, whereas the neuroglial cells are not excitable cells. Understood? And we also seen the classification. For the classification, we divided entire nervous system into the two parts. The first part we called it as central nervous system. Very good. And another part is called as peripheral nervous system. We make the division of also in the central nervous system. We divided central nervous system into the two parts. The first part is called as the brain, another part is called as the spinal cord. And in the peripheral nervous system, again the two division, one is called as the somatic nervous system and another one is called as the autonomic nervous system. Understood? So in today's class, we will study about the meninges. Write it down. We will study about the meninges. Now, I hope you all are fine, well, okay. You know that your body parts, okay, is very, you can say, created in a safe manner, okay. During your formation of your body, creation of your body, safety has one of the paramount importance, okay. So, and when you put your attention, you are gonna surprise that the organs which is working, you can say, which is mastering the systems, okay, which is mastering the system, which is controlling the other systems, okay, they are protected, okay, you can say the more precisely or more accurately. Understood? Your nervous system, as we said that the nervous system is a main control and command organ, isn't it? It means their protection has a great role, okay. Their protection is, you can say, the paramount importance, okay. We have to, like, those who create this body, okay, we call it God. So in their glance, they knows that, okay, this organ is playing a pivotal role or a key role to regulating the other systems. It means I have to make them in such a way that they will affected, okay, less. They will affect less by the external agents, okay, the external, you can say, the traumatic sources as well as the internal sources as well. Understood? No problem. So for that, in the central nervous system there are many protection, but one of the protection is the meninges. One of the protection is the meninges. Meninges are basically the layers. Meninges are the layers which covers, okay, which covers entire central nervous system, okay. Shall I repeat once again? The meninges, okay, which is the membrane-like structure, they cover entire central nervous system, okay. It should keep in your mind always. Now, the second thing is that these meninges, they are not present in every organism, okay. There are types of meninges, okay. Mainly the three types, and these three types of meninges, they are not present entirely in every creature. Understood? It is only in the us. It's due to the evolutionary course, okay, we developed the three kind of layer, which is fantastic layer, which is a kind of fantastic membrane. Understood? So what things we will cover in the understanding of meninges is here. First, we will deal with the introduction, then the types and their clinical importance. Remember, these meninges, they have great clinical importance. Okay, these meninges, they created some of the spaces which we will see after a few minutes. Okay, and those spaces have great clinical importance. Those spaces have the great clinical importance. So let's begin with the understanding of meninges. As I said that it is a protective membrane in central nervous system. It's a protective layer, okay, which covers the entire central nervous system. No problem understanding? Now, as you know that your central nervous system is divided into the two, you can say, the parts. Okay, two parts. The first part you term as the brain, okay, and another part you term as your spinal cord. Now, the things which you have to remember is that the meninges which covers the brain, they are called as the cranial meninges. Okay, they are called as the cranial meninges. No problem understanding? Now, the membrane which cover the spinal cord, they are simply called as the spinal meninges. Okay, they are called as the spinal meninges. Okay, cranial meninges, it is a covering of the brain, and the spinal meninges, which is covering of the spinal cord. Okay, another thing which we have to understand is that the cranial meninges and the spinal meninges both are the same meninges. Okay, just name varies due to their location. Due to their location, okay, their name is varying. Understand? No problem. Now, these meninges, they are membranous in nature. Meninges are membranous in nature. Now, what I mean by the membranous structure? See, there is not a one layer is present. There are three layers, and these three layers, they are a membrane type. They are a membrane type. So we can say that these meninges, okay, these meninges, they are, yeah, meninges are membranous in nature. Membranous in nature. Understood? No problem? Okay. Now, the function, if we talk about the function of these meninges, their function is to protect, okay, or you can say channelize the function of brain and spinal cord smoothly. First one is it's to protect the brain and spinal cord, that's the entire your central nervous system, okay, entire central nervous system. Another thing you should remember is that they also help to channelize the smooth business of brain and spinal cord. Understanding how you will see later in this lecture. But for a while you just understand, first function is the protection. Okay? The first function of these meninges is the protection. Understanding? Another function is to help the central nervous system to drive their function smoothly. Okay, so you can say the smooth cooperation or smooth maintenance of CNS, central nervous system. So these are the two functions. First one is the protection, okay, another one is a smooth maintenance of central nervous system. Now tell me about their embryology. Did you know that where from these meninges are derived? Okay, so before going to understand the embryology, you just understand that there are, as I said, that they are membranous in nature. Okay, they are not a one in number, they are three in number. We are discussing that now, the type of meninges. Okay, and there are three types. Okay, you write down on the top. Okay, I am starting from outer to inner. Okay, outer layer, middle layer and inner layer. Getting? Now the outer layer is called as the dura mater. No problem? Understanding? Yeah? Now the middle layer is called as arachnoid matter. Getting? Now the inner layer is called as pia, or another pronunciation is the pia mater. Pia mater or pia mater. So the outer layer is your dura mater, inner layer is arachnoid mater, and the middle layer is arachnoid mater and the inner layer is your pia mater. It means we have three types of types of meninges. Getting the points? Yeah, we have the three types of meninges now. As far as their embryology is concerned, okay, where from it's derived, okay, from where it's derived, these layers, from where it's derived embryologically. As I said, we have the three layers. Okay, and do you heard about the germ layers? Okay, from where the major organs, okay, parts of the body, they are developed. So the dura mater, okay, they develop from the mesoderm. Write it down. They develop from the mesoderm. Okay, it's your dura mater. Are you following? Yeah. Now the another two layer, that's your arachnoid matter and pia matters. Their origin, or we can say their embryogenesis, is the same. They are derived from the ectoderm. Ectoderm. Now, because they are derived from the ectoderm, okay, and structurally both are, you can say, bit softer, or you can say the more softer than the dura maters, so they are termed as leptomeninges. Write it down. Okay, ectoderm, from the ectoderm, these two both layer, that's called the arachnoid, okay, matter, and your pia or pia matter, understood, they together jointly called as leptomeninges. Getting the points? Yeah. Now let's summarize it once again. We are discussing the protective covering of our central nervous system, and we term these as a meninges. Okay, we term as these meninges. Remember always that the meninges was derived from the Latin word, okay, derived from the Latin word which means membrane, okay. Now these meninges, or you can say the protective layer, okay, it is present in the central nervous system. And the parts, or we can say the parts of meninges which covers the brain, they are termed as the cranial meninges, understood? And the parts which cover the spinal cord, they are termed as the spinal meninges. Is easy to understand, okay. Now these meninges, as their name suggests, they are membranous in nature. They are not in a one. As far as their types is concerned, there are three types. First one is from outer to inner. If we see, the first layer which is present is the dura mater, okay. Then there is the second, which arachnoid matter, and third one is the pia mater, understood? Now function of these meninges, the first foremost important function is to providing the protection. It is meant for the protection, understood? And the next thing is, it's also help to maintain the smooth business of brain and spinal cord, or we can say the central nervous system. Understanding? No issue, no problem. Now embryologically, the dura mater is derived from the mesoderm, okay. This germ layer is called as the mesoderm, and the arachnoid and pia mater, they are, you can say, both are derived from the ectoderm, and they are, you can say, structure wise bit softer than the dura mater, so they are also called as leptomeninges. Okay. And the thing is, these meninges, these three layer of meninges are not present in every animals, okay. It's us where these three layers are profoundly present, okay. We can say the dominantly present, understood? No problem. Now we are going to see the location where these layers are situated, understanding, okay. And we will also see each layers in detail. As I said, because these layers, they created the spaces, and those spaces are clinically very, very important, understood? To you that how these are present, these layers are present. So this is a anterior cut section of your central nervous system, understood? And this is your cerebrum, midbrain, okay. Then pons, medulla, and this is the spinal cord. Understood? Now you know that your brain, okay, and the spinal cord, they are protected by the skeletal system too, okay, understood? Now the cranium, called the brain box, which covers the brain, and the vertebrae which protect the spine cord, okay, the spinal cord, understood? Now, but you know that this is, as I said, the brain is a main organ, okay, and it need more protection, okay. They are not secured only by the presence of brain box, or you can say the spinal cord, understanding? No, that's the, you can say, the common life activity of a person. Yeah, like sometimes we have one kind of protection, understood? But we want more protection, we want more security in our life, okay, and that's why we are suffering, isn't it? Okay, no problems, we are not suffering, okay, we are not suffering, we are here for the overcoming the suffering of others, okay. If you worried about only our suffering, there is no use of life, okay. Now let's come to the lecture, okay. The first layer which we are seeing, okay, I am starting from the inner to outer. The first layer, okay, leave this inner layer. Start from the outer layer. See, in the topmost of your brain, as I said, there is a presence of you can say the brain box, or we can say the cranium. Now the cranium have one layer. Okay, this cranium have one layer. Okay, which making the cavity of the brain, and this layer is called as clavicum. Okay, write it down. This layer is called as the clavicum. Understood? Now, and this is your, you can say the cranium box, bone. Okay, now the dura mater we are discussing now, the first layer. Okay, the first layer, write it down. It's our dura mater. Now, the thing which should you remember about the dura mater is that their name, first of all. Dura means what? You use this word in your common, you can say the lifestyle, that the dura, or you can say the durable, means like more reliable, more, you can say the strong. So dura means the strong. Okay, and matter means mother. Matter means mother. Okay, so it's a strong mother which protected their child. And here, who is a child? Yeah, who is a child? The entire central nervous system. Entire central nervous system is a child. Okay, it's acting like a child, whereas the dura mater is working like a mother. Okay, and here the function of dura mater is that to protect their child, okay, from the external injury, So for protecting from the external injury, mother have to be hard. Okay, if it is soft, okay, or you can say if it is weak, okay, and if it is emotional, then it cannot protect from the outer, you can say the enemies. Okay, so this mother have to be hard. Okay, so it is a hard, first thing. Second thing is that initially scientists are thinking that dura mater is a avascular structure, or we can say there is no any blood supply in the dura mater. But now the research reveals that the dura mater is a highly vascular layer. Okay, it's a highly vascular layer. Okay, and mainly the artery which is present, okay, is important. You just write down. It's called the medial meningeal artery, medial meningeal artery, or medial meningeal artery. Medial meningeal artery. Put the star mark on it. Yeah. Medial meningeal artery. Understood? No problem? Now, the another thing you should remember about this layer is that this layer are dual in number. They are a dual in number, or this is a double layer. Okay, this meningeal layer, or you can say the first layer, that's your dura mater, is a, it's a double layer. So it's a dual layer. No problem. Now, and don't forget, it's a outer layer of brain. Okay, it's the outer layer of brain. Now, see their location, how they are situated. The first layer of the dura mater is very much, you can say, completely attached with the clavicum. Okay, with the clavicum. Understood? No problem? Yeah. Are you getting the point? The first layer of the dura mater, they are attached with the clavicum, that's your bone, and this layer is called as, this layer is called as, very good, periosteal layer. You know many things, I know. Periosteal layer. Understood? Now, the properties, or you can say the things which you have to remember about the periosteal layer is that they have two things. First one is the fibroblast, okay, and second is osteoblast. Okay, and they are very much connected with the clavicum, that's a layer of the bone. Okay, or that's how we can say that this is attached, this periosteal layer of the dura mater is attached with the clavicum strongly. Understood? Now, beneath the, you can say, the periosteal layer, there is another layer which is present. Okay, I should change the color, and this layer you are seeing this, they are attached. Okay, they are attached with the first layer, periosteal layer. Understood? They are attached with the periosteal layer. Now, the things which you have to here remember is that there are spaces. Okay, there are the spaces. The first space you should remember, generally the periosteal layer and clavicum. Okay, periosteal layer and clavicums, they are, you can say, firmly attached. Okay, but there are some potential space. Okay, there are some spaces, as I am leave it in a vacant. So these spaces are present. So the space which is present between the you can say the clavicum and your periosteal layer, this space is called as the epidural space. Okay, write it down. The space which is present between the periosteal layer and clavicum, okay, this space, okay, you should write here, this space is called as the epidural space. Epidural space. Now, you are thinking that why I am emphasizing on this space? Because there is a clinical, you can say, the importance of this space. Sometimes what happens, as I said, there are the meningeal artery. Okay, there are the meningeal, you can draw it, there are meningeal artery, okay, which is present in the between the periosteal layer and clavicum. Okay, between the periosteal layer and the clavicum, and they you can say, just because of this presence of this artery, there is a one bit potential space. Okay, there is a bit potential space, and this space becomes sometimes victim. Okay, this becomes sometimes victim due to the TBI, that's called the traumatic brain injury. Okay, and sometimes the other things like the infection, coagulopathy, hemorrhage, okay, and vascular malformation, they also break this artery, okay, and there will be the collection of, you can say, the extra-axial collection of the blood, okay, extra-axial collection of the blood in this area. Now see, if you see this area here, there will be the extra collection of blood, okay, because of the TBI. That's called the traumatic brain injury. Now this traumatic brain injury lead to the collection of blood, okay, and this is called as the epidural hematoma. Very good, it's called as the epidural hematoma. Write it down. Epidural hematoma, just because of the breakage of this artery, okay, by the traumatic brain injury. Traumatic brain injury implies many kind of injuries. Sometimes the blunt injury, okay, you can say gun firings, okay, gun firings, they can create the blunt. Then sometimes the severe, okay, severing injury, okay, sometimes the road traffic injury, they also lead to the you can say the hemorrhage, and this hemorrhage is called the epidural hemorrhage, and just because of this hemorrhage there is a formation of hematoma, okay, and this is called as the epidural hematoma. The epidural hematoma, okay, 10%, if we talk about the etiology, then 10% is just because of the TBI, traumatic brain injury, okay, and rest 90% is by the other sources, like sometimes there will be you can say the blood coagulation, that's called the coagulopathy. Write it down, that's called the coagulopathy, okay, understood. Sometimes there will be the abscess formation, okay, meningitis, you heard about the meningitis, it's a inflammation of this membrane, okay, inflammation of the meninges is called as meningitis, and if the dura mater is severely affected, okay, it can also create the epidural hematoma. Understanding? Yeah. Then sometimes the tumors, okay, sometimes tumors also affect this area, that's called the epidural, yeah, epidural space. Understood? No problem. Now if you see this hematoma in CT scan, they are looking like a lens shape, okay. This epidural hematoma, they are looking like a biconvex shape, or we can say the lens shape. Understanding? Yeah, they are looking on the MRI as a lens shape. Now there are common signs and symptoms which you should know. The first one is elevated blood pressure, irregular breathing, and bradycardia, okay. The sign and symptoms you can remember by this triad, okay, this triad. That first one is the hypertension or elevated blood pressure, yeah, hypertension, okay, bradycardia. Do you know the bradycardia? Yeah, bradycardia, less heart rate, okay, it's a slow heart rate, and the irregular breathing. This triad is called as the Cushing triad. This is termed as the, write it down, this triad is called as the Cushing triad. Understood? No problem? Yeah. Now if we you can say see the other feature of this hematoma, then it lead to the increased intracranial pressure. Increased intracranial pressure is also one of the hallmark of the epidural hematoma. Okay, let's summarize it once again. Do you know about the intracranial pressure? Yeah? Know it? No? Okay. No problem. See, the intracranial pressure is the pressure created by the fluid which is present in the, you can say, the central nervous system as well as the tissues, okay, on the wall of skull. On the wall of skulls, they exerting one kind of force, okay, and this you can say getting one kind of pressure or one kind of force, and this is called as the intracranial pressure. Getting? Not getting? See, how you define the pressure in physics? Yeah, very good. It's a force upon force per unit area, okay, force by area. See, here the area is this, okay, area is provided by the skull cavity first of all. See, now what is the force? Force, as I said, the fluids which is present in the central, you can central nervous system cavity, okay, and the, you can say, the brain tissues, okay, you have neurons, you have microglial cells, okay, you have other cells, understood, and they are exerting one kind of force on this area, and this is termed as the intracranial pressure, okay, this is termed as the intracranial pressure. Now what is happening here? Just because of the creation of the extra, you can say, collection of blood, they raise this intracranial pressure, okay, and that is the one of the sign of the epidural hematoma. Okay, so let's summarize it once again. We are discussing the dura mater, understood, and we said that the dura mater is a strong mother, okay, dura mater is a strong mother, okay, and it's previously it was thought that it is not a vascular layer, but nowadays it's clearly proved that the dura mater is a highly vascular membrane, okay, and the artery which is present is the medial meningeal artery as well as the you can say the anterior meningeal arteries are also present, okay, and this dura mater is a dual layer, okay, dual layer. The first layer which is attached with the cranium, we can say the cranium layer, that's called the clavicum, okay, and this layer of the dura mater which is attached, okay, on most of the place with the clavicum is called as the periosteal layer, okay, and it is a strong fibrous layer, okay, containing the fibroblast and the osteoblast. Now another layer of the dura mater is called as the meningeal layer, okay, another layer which is also, you can say, the present or you can say the lined together with the periosteal layer is called as the meningeal layer, okay, is called as the meningeal layer. And the thing which you should remember is that there is not a, you can say, the clear-cut space is present between the periosteal layer and the clavicum. Between the clavicum and the periosteal, there is no any clear-cut, there is a bit space that we call as the potential space. Now what is happening here in this potential you can say the potential space, there is one artery that's called the medial meningeal artery, and sometimes due to the trauma, okay, that's called the traumatic brain injury or coagulopathy, okay, and the tumor formation, understood, these things can lead to the rupturance of this artery, okay, and due to the rupture there will be a collection, okay, and this rupturance is termed as the hemorrhage. We said that is a epidural hemorrhage, understood, and there is a collection of blood, there is a collection of blood as I shown in here, there is a collection of blood. This is called as the epidural hematoma. If we looked in the MRI, they are if you look in the CT scan, they are looking like a lens shape or biconvex shape, understood. See, the second thing is that the signs and symptoms of this epidural hematoma we can understand by one triad that is called the Cushing triad. That is a patient have the elevated blood pressure, hypertension, okay, they have the slow heart rate, that is bradycardia, and they have the irregular breathing, understood. With all these signs and symptoms, they also have the increased intracranial pressure. They have also the increased intracranial pressure. Understood? No problem. Now, as far as the treatment is concerned, this is the emergentic condition. Okay, that's the emergency. So it need to be resolved as soon as possible. Understood? No problem. Now, once you understood about the epidural space and the first layer of the dura mater, that's called the periosteal layer. Now let's move ahead and discuss the another layer of the dura mater here only. That, as I said, that's called the meningeal layer. This red one, as you are seeing, this layer is your meningeal layer of dura mater. Now, these meningeal layers and the dura maters, okay, between the periosteal layer and the meningeal layer, there is another space, and that space is called as the subdural space. Okay, write it down. This space is called as the subdural space. See, there is no generally the space is present. Okay, and remember this space is a pathologically created space. Pathological space. Are you getting the points? Yeah, it's a pathological space. Understood? Now, the one thing which you should remember in this subdural space is that there are presence of breathing artery, or you can say also the presence of breathing veins. Okay, write it down. In the subdural space, okay, here I'm showing you by the green, there is a presence of breathing vein. Okay, now before describing this breathing vein, you should just remember that dura maters make two special kind of foldings. Okay, write it down. It's a dual layer. Just you write down the name first. First one is your periosteal layer. Okay, another one is your, it's the meningeal layer. Now, the things which you know is that the dura mater is making two kind of special folding. Okay, what are these special folding? The special folding is that they are making the sinuses, okay, and the dural reflection. Okay, they are making the sinuses and the dural reflection. The sinuses which is present in the top region, it is called as the dural venous sinus. Okay, it's called as the dural venous sinus. Understood? It's the dural venous sinus. Understood? Now, the function of this dural venous sinus is that they are a house of the venous drainage. Okay, you know that from the, you can say this cerebrum. Okay, there is a you can say the veins which is going to drain in this area, and the veins which is draining in this area is called as basically the breathing veins. Okay, which help to drain the cerebral, you can say the venous blood into the dural venous sinus, and this is called as the this vein is called as the breathing vein. Now, breathing vein, write it down. It's your breathing vein. Why I am emphasizing on this breathing vein? The reason behind the providing the, you can say, the too much highlight this point is that sometimes what happened, there will be a rupturance of this breathing vein. Okay, that lead to this subdural hematoma. Write it down, or we can say the subdural hemorrhage. Subdural hemorrhage. Now, these subdural hemorrhages, they are very common in pediatric patients. Okay, write it down. In the pediatric patients, this is very common. Okay, do you know the age group of the pediatric patient? Yeah, do you know? Pressing why I'm asking a small question, because sometimes what happened, like we don't know the answers, okay, and while we are in a classroom we don't know answer and we are just, yeah. So I don't want my students to like working like this, so I'm just checking. You know it probably that the pediatric patient is like from the, you can say from the 2 years, okay, till the 10 years, and the, you can just 18 years, okay. This is a pediatric patient, okay, age group. Pediatric patient age group. Understanding? No problem? Yeah. Now, where we are discussing the subdural hemorrhage. As I said, this is a very common in the pediatric patient, and why? You know that children's, they are naturally they are naughty, okay, because like it's a God creation, okay, and that's very useful for their, you can say the psychomotor development, okay, psychosexual development, and we can say the overall development for that. Their naughty behavior, naughty natures, curious about to knowing the things, okay, curious about to understanding the process, okay, asking the questions rapidly. That's necessary for their overall development. So sometimes what happened, due to the irritation by the activity of child, we can say due to the irritation and due to, you know, the child behavior is like they want their wishes fulfill on the spot. They won't worried about your limitation, okay. They want that their you can say requirement fulfill, their wishes fulfill on the spot. And sometimes parents, or you can say the caregiver, they lose their patient, okay, and they shake the child, okay, they shake the child, and due to this sickness there will be the rupturance of this breathing vein, okay. There will be rupturance of the breathing vein, leads to the subdural hemorrhage, okay, subdural hemorrhage. Understood? So for God's sake, please behave politely with the children, okay, please behave politely with the children. Now, so another cause is the traumatic birth, okay, traumatic birth due to on the parturition time, okay, on that very moment, just because of any, you can say the mechanical instrument injury, this hematoma or this hemorrhage can be happen, okay. Now, if we talked about their sign and symptoms, okay, just write down the sign and symptom. Is the abnormal breathing pattern, okay, apneic episode. Now, there is a you can say the irritability or lethargy, okay, then there is a seizure, behavior problems, abnormal movements, and the vomitings. So these are some of the signs and symptoms. First what you should write it is the apneic. Apneic means absence of breathing, okay, for a while. So it's the apneic episodes. Understand? Then there is a abnormal breathing pattern, okay. Then there will be the seizures. You know the seizures? Yeah. Seizures is basically a abnormal electric activity which is occurring in the central nervous system, and that result into the seizures. And there are different types of seizures. Understood? So there will be the seizures, okay. Then one of the sign is the vomiting. Understood? Then most of the neurological problems, they are present with the lethargy and irritability. So here also the lethargy and irritability, okay, lethargy and irritability, okay. What else? Yeah. And you can say sometimes the behavior problem is also shown in some of the pediatric patients of pediatric subdural hemorrhagic patients. Understood? No problem. Let's summarize it once again. After discussing the first space, epidural space, and about the epidural hematoma, we are started to discussing about the space which is present between these two layer of dura mater, that's your periosteal layer and the breathing vein. Okay, as I said, there is no any, you can say, the potential space or natural space is present. It's a pathological space. Okay, just because of the pathology, this space is created. What is happening here in this space? There is a one extremely important veins is, you can say, present, that is called the breathing vein, which drain the venous discharge from the cerebral environment to the dural venous sinus. Okay, and sometimes due to the, you can say, the vigorous sacking of the children, okay, or you can say in angerness times we are shaking the children too much, okay, that result into the rupturance of this breathing vein, okay, that result into the subdural hemorrhage and subdural hematoma. The signs and symptoms of this subdural hematoma is the seizure, vomiting, okay, difficulty in the breathing, apneic episodes, understood, then behavior problems, lethargy with the irritability. Okay, and this is common in the pediatric patients, okay, and sometimes the traumatic, you can say, the birth can also lead to the subdural hemorrhage. Understanding, once you understand about the epidural space, subdural space, periosteal layer and the meningeal layer of the dura mater, let's move ahead and discuss about the another layer, that's called the arachnoid matter. Just remember about that, there are four sinuses, okay, which is formed by this dura mater's folding, and there are two dura reflexes. First one is called the falx cerebri and another one is called the tentorium cerebri. Falx cerebri and tentorium cerebri. Understood? No problem. Now just go and discuss the second layer, that's called the arachnoid matter. Till here you have any doubt? Yeah? No doubt? Okay. Now just make the small this layer. Now the first outer layer we discussed. Now the first outer layer, it is your dural venous sinus, okay, and this was your periosteal layer, okay, and the first layer, as I shown on the dura mater, that is periosteal layer. Okay, beneath this periosteal layer there is a meningeal layer. Okay, till here no problem? Yeah? Till here no problem? Okay. So let's join these layers. Now, the second layer which we are going to discuss is arachnoid matter. Okay, second layer which we are going to discuss is our arachnoid matter. Arachnoid matter. Yeah. Now the things which we have to remember is that this arachnoid matter is sitting, okay, the arachnoid matter is sitting between the two layers. First the dura mater and the inner layer, that is your, yeah, that's your, very good, tell me, yeah, pia mater. This is your pia mater, okay, which we will discuss in a few minutes. And the another layer okay, which is present between these, you can say the sub, okay, once again, this is your dura mater, okay, and between the dura mater and this meningeal layer there will be a one more layer, and this layer is called as, this layer is called as the arachnoid mater. Arachnoid mater is avascular, okay, it's a soft wave like structure, okay, and a lucent, it's a lucent layer. Understanding? So about the subarachnoid matter, you just write down, it is avascular, okay. Now it is a middle layer, okay, and about their nature, it's a thin, okay, wave like structure, okay, and it is a lucent. Understood? Remember one thing, that the nerve supply is common for the three meninges, okay, that's your vagus nerve, 10th cranial nerve, and cranial number 5th, that's your trigeminal nerve. Write it down, that about the nerve supply of the meninges, nerve supply, these are two nerves. First one is your 5th cranial nerve, okay, another one is your 10th cranial nerve. 5th cranial nerve is your trigeminal nerve, and the 10th cranial nerve is your vagus nerve. No problem? Now about this meninges, lymphatics, okay. Initially it was thought that the brain, or we can say the central nervous system, is free from the lymphatics, but recently in 2015 there were the scientists, okay, who searched that there are presence of, you can say, the good lymphatic system in the central nervous system, which helping the central nervous systems to clear their garbage, or you can say to clear their excretory materials, okay. And the thing is, these lymphatic systems, they are linking the immune system with the nervous system, okay. And this is called as the this lymphatics, we have the dual lymphatic vessels, okay. We have the dual lymphatic vessels. It is 2015 discovery, okay, 2015 discovered. Understood? Till here no problem. Now come to the point. We are discussing the arachnoid matter now. The space which we discussed previously, that is called as the space which is present between the dura mater and the arachnoid mater, okay, and this space as we term as the subdural space, okay. Subdural space, this space is present here, and we talked about already the subdural hemorrhage, subdural hematoma. Now the thing which you remember is that between the subarachnoid matter, and the pia mater, this space, okay, is very important space. Why I am saying it's important? I'm just highlighting this space so that you can visualize it properly. I am talking about the space which is present between the arachnoid matter and the pia mater. This space is called as subarachnoid space. Write it down. It's called as the subarachnoid space. This space is meant for very special function. Do you heard about the CSF, a major fluid in your central nervous system? Can you say the function of the CSF? CSF is a cerebrospinal fluid. It's a cerebrospinal fluid, okay, which is you can say formed by the choroid plexus, which is present in the ventricles of the brain. See, in this area, okay, I'm just roughly drawing. See, this is your ventricles of brain. We will discuss in our next video. This is the ventricles of the brain. This is called as the, you have two lateral ventricles, one third ventricles, and this is the cerebral aqueduct, this is the fourth ventricle, and this is the central canal, okay. And in this, there is a presence of a very special structure that's called the choroid plexus. Here the CSF is formed, okay, and this is drained and circulating from the here. Now, there is one window present here, okay, in this region that's called the cerebropontine region, okay. Here there is one window is present, and we term this window as a foramen of Monro, okay, foramen of Monro, and this is one more present, that is called the foramen of Meninges. Are you understanding it? Now, through this window, the CSF will come into this space, subarachnoid space, okay, and continuously it is floating. So the importance of the subarachnoid space is that circulation of CSF, Another important function is that in this space there is a one circle present that we term the circle of Willis. Do you know about the circle of Willis? It's a collateral blood supply, and it's a unique type of blood supply which we will discuss again in another lecture. But for a while you just understand that the major artery which is coming from the heart, arch of aorta, okay, they are making one circle, okay, and this circle is called the circle of Willis, and this is the collateral blood supply. Because if one artery got occluded, or you can say the one artery get blocked, understood, then other artery will supplement, you can say the complement their blood supply. That's called the collateral blood supply, and that is circle of Willis. Circle of Willis is also present in the subarachnoid space. Basically it is a floating in the CSF. It is basically bathing in the CSF. Understood? Now, another important things about the subarachnoid space is the subarachnoid hemorrhage, okay, is the subarachnoid hemorrhage. Here there is a cerebral arteries, okay, cerebral arteries which is present in this area, okay. In this area there is a cerebral arteries. As I told, there is a circle of Willis present, okay, and these are the arteries. Just concentrate here. These are the arteries, okay. Now, sometime what happened, there will be a rupturance of one artery that's called the cerebral artery, okay, and that lead to the subarachnoid hemorrhage. Subarachnoid hemorrhage. Understanding? This area got hemorrhagic condition, okay, and there will be a collection of blood in this area. Sometimes what happened in these arteries, okay, there will be a bulge like formation that we term as the aneurysm, okay. In the circle of Willis, okay, the arteries which is forming the circle of Willis, sometimes they have the you can say the bulging appearance, and these bulginess, that's called the aneurysm, okay. They are sometimes spontaneously ruptured, okay, and result into the subarachnoid hemorrhages. Understood? And this aneurysm is termed as the Barry aneurysm. Barry aneurysm, okay, that result into the subarachnoid hemorrhage. Understood? Now, For confirmatory test, we investigate the CSF, okay, and there will be the xanthochromium appearance. Xanthochromium appearance in the CSF. CSF become the yellowish. That shows that it's a subarachnoid hemorrhage. Understood? No problem. Now once again, we are discussing the arachnoid matter, and we said that the arachnoid matter is avascular, okay, and it's the middle layer, and it is sitting between the dura mater and the pia mater. Understood? Now this is a thin wave-like structure, and you can see the dilution in the nature, okay. The space which is the space which is present basically between the subarachnoid matter and the pia mater is extremely important, and this space is called the subarachnoid space. From here the CSF is you can say the circulating, flowing. Understood? And also the circle of Willis is present in this area. The clinical point related is this: there are cerebral arteries, okay, which going to sometimes rupture, okay, that result into the subarachnoid hemorrhage, and sometimes the circular villus which is present, okay, in the arteries of circular villus there will be the aneurysm formation, and this aneurysm is termed as the Barry aneurysm, and sometimes they spontaneously ruptures and result into the catastrophic condition that's called as the subarachnoid hemorrhage, okay. For the investigations, we investigate the CSF, and the CSF will appear xanthochromia, okay, which is a yellowish color of the CSF that confirms that is a subarachnoid type of hemorrhage. Understood? Till here you have any problem? No? Yeah? Okay, and this is not called foramen of Monro. Foramen of Monro is present here. It is called the foramen of Lashka. Foramen of Lashka, the window via which the CSF from the ventricles is going into the subarachnoid space. Understood? Once you understood about the subarachnoid matter, which is the middle one, now come and discuss about the inner layer. That's your pia mater. Sorry. And about the nerve supply, as I said, the nerve is common for both the three layers, okay, and that is your vagus nerve and fifth cranial nerve, that's your trigeminal nerve. And previously it was thought that there is no any, you can say the lymphatic system is present, but now it's clearly proved that there is the you can say organized lymphatic system is present in the central nervous system, which helping to discard the garbage, okay, because brain tissue also produce some of the excretive material. One of the important is your beta amyloid, okay, and this pile up of the beta amyloid sometimes result into the Alzheimer understanding, and there are other excretory materials. So for their drainage purpose, CSF is also helping, but there is a one you can say that dural lymphatic vessels are present, okay, and also this lymphatics connecting the brain and with your immune system. Understanding? No problem. Now let's make our diagram clear. Okay, now we are discussing the last layer, that's your pia mater, which is shown by this purple color. I'm just enlarging it. Yeah. So this layer is your pia mater, and you're gonna surprise, this pia mater is again 2. Okay. So there is a double pia mater. See, sometimes what happened, if the work of something is extremely important, okay, but for you can say channelizing those work smoothly, okay, accurately, you have to provide lots of safety, okay. And here's your brain pia mater. Now this is your first thing you should know is your inner layer. Okay, this is also the highly vascular. Okay, and it is also the dual in number. Now, the inner layer, okay, which is connected with the brain tissue. I should make this brain tissue. Yeah, this white one is your brain tissue. Okay. Okay, this white one is your brain tissue. The layer which is, you can say, the layer of the pia matter which is present, okay, or which is the touching this brain tissue, that's your glial layer. Okay, this white one is your glial layer, glial tissue layer. Understood? Now, this glial tissue layer and the first layer of the meninges, okay, is very much attached. Okay, and this first layer is called as the epipyle layer. Okay, this is called as the epipyle layer. So I should make it by another color so you can recognize it. Yeah, this layer. Okay, this is your epipyle layer of pia matter. Understanding? Are you understanding? Following? Yeah, tell me. Okay, this is called as the, yeah, this is called as the epipyle layer. Understood? Now, the another layer which is present, okay, or which is making basically the subarachnoid space between, you can say, the dura arachnoid matter. Okay, this is called as the intima. Okay, this is called as the intima pia. Intima pia. Let's summarize it once again. We are discussing the pia matter, and we say that it's the inner layer. It's a highly vascular, or it is a dual in nature. See, the first layer, which is, you can say, adhere with the brain tissue layer, that's your glial layer, is your epipyle layer. Understood? And the one layer which is making, you can say, making the space with the subarachnoid matter, that's the space is called subarachnoid space, and this layer is called as the intima pia. Understood? No problem? Now, so what we studied, let's conclude today's class. We studied about the meninges, and we said that the meninges is the protective membranous layer, okay, present in the central nervous system. Okay, it's cover both the brain as well as the spinal cord. Okay, then we seen the types. There are three types mainly, starting from the outer to the inner: dura matter, subarachnoid matter, and the pia matter. Okay, we seen the spaces: epidural spaces, subdural spaces, and subarachnoid spaces. We seen their pathologies, the hematomas. Understood? We seen that, yeah, we seen that the dura matter is previously thought as they are avascular, but nowadays it's unstable that it's a highly vascular and mainly housing the which layer? Yeah, very good, it's the medial meningeal layer. Then about the subarachnoid space, they are the avascular. Okay, we talked about the blood supply, they are avascular, whereas your pia matter, they are highly vascular. Okay, pia matter is a highly vascular. Understood? And it is a deepest layer. No problem. Then we studied about the different kind of, you can say, the hemorrhages. Understood? Okay, their etiology and how they are happening. Okay, how they are happening. Then we seen that previously it was thought that there is no any lymphatic system is present in the central nervous system, but in 2015 research, it shows that there is a you can say well functional lymphatic system is present in the central nervous system, which is helping to discard the garbage of central nervous system, and that is termed as the dual, yeah, it's a dual lymphatic system. Understood? And the thing is, you should remember is that the nerve supply is common. Okay, the vagus nerve and trigeminal nerve, they are jointly, you can say, innervating these layers. And another thing you should remember in your mind is that as far as the embryological perspective is concerned, the dural matter is derived from the mesoderm. Okay, and both your the arachnoid matter and the pia matter, they are derived from the mesoderm, and they are also called as the leptomeninges. So by this we stop today class. Thank you with having me. Bye. Have a nice day.